In this video, we'll be talking about NSAIDs. NSAIDs is actually an acronym for a class of drugs called non-steroidal anti-inflammatory drugs. To understand how NSAIDs work, we first need to understand the pathway which they act on, which is the arachidonic acid pathway. Arachidonic acid starts off bound in the membrane and is converted to free arachidonic acid by the enzyme phospholipase A2. It then heads down two major pathways, the lipooxygenase pathway and the cyclooxygenase pathway. NSAIDs act on the cyclooxygenase pathway. As we continue down the cyclooxygenase pathway, we get a variety of end products, including prostaglandins, prostacyclins, and thromboxane. It's the cyclooxygenase, or COX enzyme, that acts to catalyze this conversion at two key points at the start of the pathway, as you can see here. NSAIDs act to block the action of COX, and therefore block the pathway. Here we can see that PGH2 is converted into prostacyclin, also known as PGI2. Prostacyclin is a vasodilator, it decreases platelet aggregation, and it's hyperalgesic, meaning it increases sensitivity to pain. PGH2 is also converted into thromboxane. Thromboxane is thrombotic, meaning it helps clot the blood. It's also a vasoconstrictor. PGH2 is also converted into the three key prostaglandins, including PGD2, which is a vasodilator, it decreases platelet aggregation, and it relaxes the gastrointestinal tract. PGE2 is also a vasodilator, it increases sensitivity to pain, can increase fever, can cause contractions of the uterus, and decreases gastric acid secretion. PGF2 alpha is a bronchoconstrictor and can cause myometrial contractions. Understanding these actions is key to understanding the benefits and side effects of NSAIDs. There are two different forms of the COX enzyme. COX-1, which is found in all tissues and has the main products of thromboxane, prostaglandins, and prostacyclins, and the inducible form of COX, known as COX-2, which is only found in specific tissues. Its main products are the prostaglandins PGE2 and PGI2. Therefore, there are different types of NSAIDs which target the different forms of the COX enzyme. There are COX-1 selective NSAIDs, mainly low-dose aspirin, COX-2 selective NSAIDs, such as Celecoxib, and non-selective NSAIDs, like the commonly used ibuprofen, which is sold as Advil. So, why would you want to take an NSAID? Well, there are multiple indications for taking NSAIDs. Maybe you want to reduce inflammation by reducing PGI2 and the prostaglandins. Or perhaps you want to reduce analgesia by reducing PGI2 and PGE2. But what if you want to reduce pain? Well, NSAIDs are generally not recommended due to their gastric side effects. Instead, take something like paracetamol, which is not an NSAID. Maybe you want to reduce blood clotting by reducing thromboxane. NSAIDs are good for this. So what are some of the side effects or consequences of blocking COX-1 and COX-2 action? Well, you can have an increase in bronchoconstriction. This is because you are diverting the arachidonic acid down the lipoxygenase pathway instead of the COX pathway, which increases bronchoconstriction. You can also have an increase in bleeding because the decrease in thromboxane decreases platelet aggregation. You can also experience gastrointestinal ulcers. This is because the decrease in PGE2 and PGI2 increases gastric acid and decreases mucus. You can also experience decreased renal function and increased sodium retention because the decrease in PGE2 reduces blood flow to the kidney. Of course, the main positive outcome is a decrease in inflammation, pain, and fever, and this is because of the decrease in PGI2 and E2, which decrease sensitivity to pain, fever, and vasodilation. NSAIDs can interact with other common drugs, such as diuretics. As we know, NSAIDs reduce blood flow to the kidney, whereas diuretics aim to increase the excretion of sodium and water to reduce your blood pressure. If taken in combination, these competing aims can place extra strain on the kidneys and even potentially raise your blood pressure. NSAIDs can also interact with anticoagulants, such as warfarin. As we know, NSAIDs reduce thromboxane levels and therefore reduce platelet aggregation, whereas a drug such as warfarin also thins the blood and reduces coagulation. Therefore, if taken together, it can place you at an increased risk of bleeding. NSAIDs can also interact with ACE inhibitors. As we know, NSAIDs reduce the level of PGI2 and PGE2 and therefore decrease the level of vasodilation, whereas ACE inhibitors act to increase vasodilation. These competing aims, if taken together, can prevent an individual from reaching their blood pressure goal.